don't take the NCLEX until you watch this video. That's right. So in this video, I'm going to tell you guys the things that I memorized, or at least had a solid foundation of, before I took the NCLEX. So if you guys don't already know, my name is Nurse Gabe. I'm an ICU nurse, and please like and subscribe my channel for more nursing content that is going to help you. All right, so the very first thing I'm going to tell you guys is you want to know your infection precautions, infection control. So what that includes is your airborne, droplet, and your contact. When it comes to these, you want to know the diseases that fall under each one. You want to know the PPE that is required for each one, as well as you want to know the nursing interventions, if there are any for them. Okay, moving right along, you want to know your insulin. You want to know insulin pretty well. There may be a few questions on it. You want to know the type, the generic, the peak, the onset, the duration. And I would just go about memorizing the more common ones, the common names of ones. Next, you want to know your lab values and your vital signs. And just knowing, the values, because it will vary per book, but knowing the ones that you got during nursing school, that would be enough. But if you're already utilizing one of those resources like Archery World or Kaplan, then you could also use the lab values that they give there. And if there's two, there's a male, female lab value. What I did is just memorize the female low and the male high. And then that was enough. And then for vital signs, make sure to remember and to review that vital signs change, with age. As they're younger, they're different compared to a 20-year-old or, so on. Okay. And then, so those are the main basic things. And then a few other things that you want to memorize are going to be scopes of practice. So know what we can and cannot do as the nurse, know what the LVN or LPN can or cannot do, and know what the CNA or the UAP can or cannot do. They can possibly ask a few questions on those. And then also you want to know your therapeutic drug levels. There are drugs that it is very imperative, very important that we, know the therapeutic drug level. And then along with that, you want to memorize antidotes, the common antidotes to opioids, to benzos, to heparin, to Coumadin. You want to have those antidotes memorized. Okay. So with this content, and along with other stuff that I will mention in future videos, this is a great starting point if you're starting to study for the NCLEX. Having this memorized, or at least a solid foundation, will help you pass the NCLEX. Make sure to review the other videos where I go over testing strategies. All right, thank you guys. See you guys next time.